Hi, I'm Dr. Michael L. Johnson. I'm a board-certified chiropractic neurologist. I've been in practice since 1983 in Appleton, Wisconsin. I'm the author of this book, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. I also consult with about 1,000 chiropractors across the country. You can look at our website, lifechangingcare.com. That's lifechangingcare, all one word, .com. And there's hundreds of testimonials up there. I'm here to talk to you today about chronic fatigue syndrome. All right, I specialize in chronic fatigue syndrome, and I'm going to show you how we treat it and how we treat it successfully. So what makes us different from every doctor you've seen? We treat you metabolically and neurologically, right and left hand. And you or someone you love is watching this DVD, or you're watching this DVD because you suffer from chronic fatigue. We don't leave any stone unturned, and that's what I'm here to talk to you about today. The first thing we're going to do is treat you metabolically. We're going to look at blood panels, and I mean complete blood panels, and don't tell me that, oh, I went to a medical doctor and my blood work's normal, because there are lab ranges which are very broad, and there are optimal or functional ranges which are very narrow. For instance, your thyroid. Thyroid can play a factor in chronic fatigue. So does your immune system. These are the two biggies. But let's get into this. Your TSH level. Normal is, lab range is 0.5 to 5.0. Normal, optimal range is 1.8 to 3.0. So what are we going to do? We're going to look at a thyroid panel. Your TSH, free T3, free T4, total T4. We're going to look at a complete metabolic panel. Not a basic, a complete metabolic panel. Blood glucose can be a factor with chronic fatigue. There's a lot of different factors. That's why you have to be thorough. You know, I get these people, oh, it's caused by a virus, it's caused by this, it's caused by that. No, there isn't any one cause to chronic fatigue. You have to run the tests, you have to be thorough. You know, I get people with chronic fatigue coming in telling me all this stuff they've had done for naught. So, complete metabolic panel. You want a lipid panel. You want a CBC without a differential. You want to look and see what the red blood cells are doing. You want to look and see what the white blood cells are doing. You want to be thorough. So if you have chronic fatigue, we can assess your thyroid, adrenal glands. The adrenal glands are your stress glands right above your kidneys. Your liver, kidneys, red and white blood cells, gut function. All of these internal functions can affect the problem with fatigue. We're going to look at sensitivity testing. I've had chronic fatigue patients, and they're sensitive to gluten, milk, soy, eggs, and yeast. They feel like crap. Well, the reason is they feel like crap is they're so sensitive to these foods that they're eating, it's just bringing them down. So we want to see if you're sensitive to gluten. Gluten is wheat, rye, oats, and barley. We want to see if you're sensitive to soy, milk, eggs, and yeast. Here are some of the symptoms of sensitivities: chronic pain or fatigue. I had one lady, she came in, she was gluten sensitive. And normal is 0 to 10 units. She was suffering with severe chronic fatigue syndrome. And her gluten sensitivity was 174. Not the highest I've seen, but pretty high. We get her off gluten, we make some changes in her diet, we get her on some nutrition, we treat her neurologically, no more chronic fatigue. But I'm saying that's, gluten sensitivity isn't the one cause of chronic fatigue. There are multiple causes, and that's what I'm going to get at here. And you could have one or all of them. So chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers, they vomit often. That's symptoms of sensitivities. You need to test for it. The only way to know is to test. We want to look at your adrenal glands. Your adrenal glands are your stress glands. This is a salivary test. If you have chronic fatigue syndrome, your adrenals are most likely involved. We want to check your cortisol levels. This is a salivary test similar to DNA, and it's measured at 8 a.m., noon, 4 p.m., and 10 p.m. And it should be highest at 8 a.m. and a downward smooth slope to the end of the day. Those are the cortisol levels. We want to look at your immune panels. Chronic fatigue syndrome could be a problem with your immune system. It could be an autoimmune disorder. It could be your immune system is attacking your nervous system. You don't know unless you test. There's two parts to your immune system, Th1 and Th2. Now, Th1, you measure it with markers. Interleukin 2 and TNF-alpha. Th2 is measured by markers. Interleukin 4 and interleukin 10. If any of those markers are high, you're dominant. You see, Th1 are T cells. T cells are the army that attacks and cleans up afterward. There's helper T cells, suppressor T cells, natural killer cell activity, regulatory T cells, and macrophages. Th2 are B cells. B cells make antibodies. They tell the T cells what to attack. So if you're Th1 or Th2 dominant, then you want to find out what's the cause of the dominance. You see, what I'm seeing with chronic fatigue syndrome, folks, is that you want to be thorough. And if you're not thorough, you're not going to get to the bottom of it, because it's easy to say, well, it's Epstein-Barr virus, or it's this, it's that. You don't know unless you test. You want to be thorough. So if you're Th1 or Th2 dominant, it could be caused by an active antigen or dysregulation. What's an active antigen? Parasites, bacteria, viruses, mold, yeast, fungi, protozoan, foods, that's sensitivity tests, chemicals, and heavy metals. The best indicator of an active antigen as the cause of a patient's abnormal dominance is the helper-suppressor T-cell ratio, also called the CD4 and CD8 ratio. We run the blood test, and this is a blood test, and it's 2.5 and above, it's an active antigen problem. So there's further testing that needs to be done to find out, like a stool microbial test. Maybe it's parasites, maybe it's protozoa, maybe it's a virus, maybe it's bacteria. But if it's 1.2 or below, it's a problem with dysregulation, it's a problem with blood sugar, or anemia, or your adrenal glands. You don't know unless you test. You know, this video will probably be up on YouTube. And a lot of times I'll get comments, oh, it's this, it's that. It's not anything until you test for it. Could be an active antigen caused by H. pylori bacteria in the gut. You test for it. Could be leaky gut syndrome. Leaky gut syndrome describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diets, parasites, or infection. Could be. Don't know unless you test. We look at neurotransmitters. We look at hormone panels. Hormones could be a causation. It may or may not be. You don't know unless you test, but I will tell you this. If you're autoimmune, if your immune system is attacking your nervous system, that trumps everything. If your Th1 or Th2 levels are skewed, that trumps everything. Has to be addressed first. We look at inflammation, C-reactive protein, homocysteine, and then we treat you nutritionally after thorough metabolic testing. And we use something called glutathione. Glutathione is the mother lode of antioxidants. That's the right hand. Now the left hand, we treat you neurologically. You see, your brain and nervous system need two things to survive: fuel and activation. Fuel is oxygen and glucose. We covered the glucose side on the metabolics. But what about oxygen? As you age, your ability to utilize oxygen decreases by 1% per year after the age of 25. It's called oxidative phosphorylation. I'm 50 years old. What happens? I've lost 25% of my ability to utilize oxygen. So we may have you on oxygen with an upper body ergometer. It's like a bicycle for your arms. Or on an elliptical machine. But we want to treat you neurologically. We want to increase frequency of firing of brain. We may use vibration therapy, stimulates the back part of the spinal cord up to cerebellum, up to brain. We may use olfactory stimulation, smelling different smells. We may use auditory stim. Listening to sound in the right ear fires the left brain. Listening to sound in the left ear fires the right brain. Maybe you've heard that. We may use visual stim. We may use an interactive metronome. Interactive metronome is auditory, visual, and motor stim. You're listening to a cowbell, you're clapping to it. Sounds easy, but guess what? It's measured in milliseconds. So, how do we correct your chronic fatigue syndrome? By specific metabolic and neurological testing and treatment. You need to ask yourself the following questions. How is your